Welcome everyone. My name is Paul Erwin and I am the Dean of the School of Public Health. I'm excited to welcome you today to this career conversation with alumni Jeff Stover. This webinar is made possible by the Office of Public Health Practice and the Public Health Student Association. Please take some time to visit the OPHP website to see past seminars and always check the PHSA calendar for upcoming meetings and events. Now let me introduce our guest. Jeff Stover is a 1997 UAB School of Public Health MPH graduate in epidemiology and is currently the executive advisor to the Health Commissioner at the Virginia Department of Health. Jeff has worked in public health for over 26 years, including 22 years at the Virginia Department of Health, where he has led prior efforts involving statewide sexually transmitted disease prevention and various statewide informatics initiatives. He is affiliate faculty at Virginia Commonwealth University School of Medicine and teaches epidemiology for South University's Physician Assistant Program. Jeff is a past board chair for the National Coalition of STD Directors. Currently, he is helping to lead Virginia's exposure notification efforts, known as COVID-WISE. Jeff previously worked at UAB as a laboratory manager and coordinator of reproductive health clinical trials in occupational health studies. He also conducted foodborne disease prevention and control activities in the United Kingdom. He was a 2013 Centers for Disease Control and Prevention Charles C. Shepard Science Award nominee and was recently recognized by Virginia Business Magazine as one of 100 people to meet in 2021. So Jeff, welcome.
It's a pleasure to be here. Thank you very much.
Great, thank you. You heard my introduction, Jeff, but to get us started, tell me a little bit more about yourself, where you work, and a little bit about what you do. And I'll ask more specific questions about your work as we get into the conversation.
Yeah, absolutely. So I'm actually a native Virginian. I went to grad school at UAB, purposely for public health. But I grew up in the beautiful Shenandoah Valley of Western Virginia. And I did my undergrad here in Norfolk. I actually was an environmental health major. There's not a lot of environmental health specific bachelor degrees, but that's what I studied in my undergrad. And I thought that I was going to go into foodborne disease. That's what I wanted to do. So I decided an MPH in epidemiology was the thing to do to get me to that place, which is how I ended up at UAB. That's not the path that I ended up doing. We can discuss that as we go along, but that's the gist of it. And I enjoyed my couple of years in Alabama, but yeah, Virginia's home. That's why I'm here at VDH.
The Shenandoah Valley is indeed a beautiful place. As I mentioned to you yesterday, I was able to spend part of my training in Western Virginia, and it is lovely country. So you mentioned the word path, career path. Tell us a little bit about your career path after you received your MPH in epidemiology.
Sure.
How did you get to where you are today, and what made you interested in pursuing a job with the Virginia Department of Health?
Yeah. So my path, as I said, it was originally focused in environmental health, and so when I got to UAB, well, just before going to UAB, because I was an environmental health major at my undergrad at Old Dominion, that incorporates industrial hygiene, as you well know, and so even though I was planning to head off to grad school, I got a job immediately after graduation. I graduated in December of a given year, so there was like a 7-month lag time, prior to grad school. And so I took a job in an environmental consulting firm in Norfolk, doing a lot of organic and inorganic, lab testing, et cetera, for businesses, asbestos abatement, those kinds of things. And so I had some lab experience. So when I got to UAB, It just so happened that my advisor was doing some clinical trials that were female reproductive health trials, and he needed someone to manage his lab. So that was an opportunity. So being an opportunist, I jumped on that. And so I worked for him for the time that I was in Alabama. And that got me into the sexually transmitted disease field, in a sense, reproductive health. And it was fascinating. I absolutely loved it. And so when I finished grad school and was looking for jobs, it just so happened that back in Virginia, because we were going to look to go back to the mid-Atlantic anyway, a position came up that was kind of an assistant director for STD HIV at the time. And so I was fortunate enough to land that position, and that kind of, steamrolled then the process of my 22, 23 years here at VDH.
Did you have any interactions with the Jefferson County Department of Health while you were in Birmingham? I'm just curious why, when you left here, you made the decision to look at public health practice.
Yeah, absolutely. We were doing some of the trials we were doing. These were female condom trials at the time. So most of your students today, they hadn't even hit puberty by the time this was going on. So to them, probably female condoms have always been a thing, but they weren't. So when the big clinical trials were going on, Jefferson County Health Department was actually the focal point of all the studies that dealt with that. So we had a lot of nested studies. There were male partner studies, all sorts of things to try and really delve into what was going on. So we recruited women and their male partners from the STD clinic at Jefferson County. So I was there quite a lot, doing things with them. And yeah, so got to know the folks at Jefferson County very well.
Great. And you mentioned in our conversation yesterday that in your work at UAB, you worked with Dr. Ned Hook, who we know here is one of the really one of the world's experts in sexually transmitted diseases.
Yeah, absolutely. And people, your students may hear you say that and you think you're boasting, and you're not boasting. Ned Hook is one of the world's leaders in sexually transmitted disease. So I think any students who are there with you now who don't know that, and they're interested in infectious disease, and I'm biased because I worked in STD for a long time, but there's no field like it. It is unique. The people who work in it are unique. It's the most diverse place you can ever imagine. And it's just absolutely fascinating. So I imagine Ned is still doing multiple studies in some form or fashion associated there. So I would encourage students to reach out to him or people who work for him as they can, because it's a great place to gain some experience if you're a student.
I just recall from my time working with the Tennessee Department of Health, some of the old-time, crusty old STD field workers who knew every trick in the book in terms of trying to find contacts of patients with STDs. And I learned a lot of shoe leather epidemiology from such staff.
Yeah, absolutely. I think most students today might think that contact tracing is a new thing, right? That in the COVID world, we've created contact tracing. That is absolutely not true. Contact tracing started in sexually transmitted diseases and syphilis investigations, et cetera, and some diseases that no one ever hears of anymore. But that's where it began. And people have been reaching out to folks in the STD field forever for those kinds of things, right? You have a TB outbreak and you need more hands, you go to the STD folks, the disease intervention specialists, that's what we call them. So they're quote unquote contact tracers. And they have been the heart and soul of it for many, many years.
To your work now, you mentioned that the bulk of your time in the Virginia Department of Health was in the field of sexually transmitted diseases, but your job has shifted, and particularly recently, it has shifted, certainly with COVID. But take us back, both pre-pandemic in terms of what a typical day used to look like for you, and then comment on how the COVID pandemic has changed this.
Yeah, so I worked in the STD HIV field for many years, for about 19 years. And so I transitioned to the commissioner's office in 2017. At that time, I was what's known as an operations director for one of our deputy commissioners of population health, and did that for a couple of years. That really involved, offices like epidemiology, which is where HIV and STD reside. So I was within the same framework for population health, but then it expanded largely to lots of other offices. So having the experience that I did and having the longevity in the health department, I know a lot of people. I know a lot of the way that things work. I know what should work well, what shouldn't work well. So operations director roles are great for that kind of thing and that kind of experience. I also managed our administrative team who are associated with population health. So all of the grants and the purchasing and the human resources, all those people that are the props guys in the theatrical show called Population Health. So those are all people that I managed. And then in March of 2020, so just about a year ago, we did some reorganizing, and I transitioned to executive advisor for the commissioner. Now, ideally, that position is kind of what you might think of as like a chief of staff for the health commissioner. Really helping to connect the dots, right? Pull people together who need to, ensuring things get done that need to get done. When people put things out, that they're doing it in a way that we need it to happen, and really the eyes and ears behind the health commissioner. So that's the intent. But as I said, I started that job on the 10th of March of last year, which is about 2 days after COVID hit, at least ramped up for us. Mm-hmm. So pretty much the entire time I've been involved as the executive advisor for the commissioner, it's been full on pandemic response. And I just happened to take over one of the big projects because you mentioned earlier that I have some informatics background. So I've done quite a lot of that. Did my 10 by 10 training through UAB, by the way. Shout out to UAB about that. Because I had some informatics background, and then we wanted to move into this exposure notifications world, which is all about the Google and Apple stuff. Most people have probably heard about that on the phone. If you haven't, you're free to call me. I'd be happy to tell you all about it. But I ended up taking over that project for Virginia and running it, and it's still going today. We're still busy with it. I've done 3 television interviews just today because we've launched some new parts of it. So it's an evolving and cyclical process that began last August, and it's still moving pretty strong as we speak.
I'm just curious, do Virginia Department of Health employees, are they strongly encouraged individually to download the app to their phones? Are they required as a part of their work?
Yeah, so we don't require anyone to do it anywhere, but we highly encourage it. And it's gone out. We've been very successful in Virginia, touch wood. We've been one of the most successful states for exposure notification. We were the first ones to launch in the country, and we have the second most downloads of any app in the country. Yeah. And so we've been very fortunate where that's concerned, and we've had a lot of support. We've been marketing like crazy since last August, and we're still doing that. But staff in general, I couldn't even tell you if I wanted to, like how many state employees or how many VDH employees have downloaded it, because it's an anonymous process. Mm-hmm. I don't know who has it, and I don't even know where in Virginia, even though we've got 1 million downloads, just a little bit under, I couldn't tell you where those have occurred because it's all an anonymous process.
We have something similar, as I know here in Alabama, where we strongly encourage UAB employees to participate with the notification app. Of course, we're all required to do the daily health check as UAB employees, but encouraged to use the notification app. So we know a little bit about what you're doing with that. Well, let's check in again with Dr. McCormick. Dr. McCormick?
Yes, Jeff, a while ago you mentioned 10 by 10 training.
Uh-huh.
Wants to know, what is 10 by 10 training?
I'm not sure that it exists anymore, but AMIA was the association, the American Medical Informatics Association, AMIA. And they did a training, I'm going to go back, they started it about 15 years ago, and it was called 10 by 10. They were looking to train like 10,000 people by 2010, I think it's where it came from, in informatics. And UAB was one of the places, you guys have an informatics program there at the university, and UAB was one of 2 or 3 universities that were doing this. So I was doing informatics work at the time in addition to STD work. And so I got involved. And when I had the opportunity to choose, University of Chicago, Illinois, or UAB to do my 10 by 10 training, I chose UAB.
Got it.
Right.
So another student asked, has your MPH been useful in your field? Could you do what you're doing now without your MPH?
Yeah, no, that's an excellent question. I think the answer is yes, I could, but it gets increasingly more difficult, because that MPH is just, it's opening some doors to you that you probably could have opened anyway, but they may have creaked more, right? May have been a door that's stuck and you had to work harder to get it open. Whereas that MPH degree kind of opened the door to begin with. You still have to prove yourself, right? You need to show that you're the person that needs to do X, Y, and Z. But that MPH is very helpful. In Virginia, and I'm not sure if Alabama is the same way, we actually don't require specific degrees for any positions, unless you're in a licensed position like an MD or a nurse. Otherwise, we don't require a master's of public health to be an epidemiologist, for example, but we can prefer it. So even in the screening process, we can add more weight to people who have certain types of degrees or experiences, and we certainly do that. But you don't have to have it, but it is very helpful.
And I would just echo that the MPH for me actually showed me where the doors were to begin with in many instances.
So Jeff, another one, wanting to know if contact tracing for COVID-19 differed from contact tracing for STDs.
So yes, it does. Contact tracing for STDs generally is the epitome of what was mentioned to begin with by Dr. Erwin about shoe leather epidemiology. It is knocking on doors with your pad and pencil, and going out there, finding people, talking to them about their sexual partners. Not an easy thing to do. Very few people want to talk to a stranger about who they had sex with 3 days ago. And so that process is different in that it's very much manual and in person. Whereas contact tracing for COVID, there's just too many, right? It's almost all done by phone. And we don't even follow up with everybody. You don't get the choice in the STD world to not follow up on certain syphilis cases. That's not an option, right? Whereas with COVID, we're going to those that we might feel are the most critical at any point in time because we simply don't have the staff to get to all of them.
And then I think another related question, what do you think are some ways for public health professionals to build trust in communities?
I think the way we do it is by being present. We have to make it known who we are and what we're doing, and perhaps even more importantly, listen to what people are telling us. I don't need to, I'm preaching to the choir when I'm talking to folks in Alabama about the Tuskegee studies, but that is at the very heart of public mistrust, and public mistrust kind of started in public health and Tuskegee and the syphilis studies that were done. So in order to really get buy-in from populations who don't trust us, we really have to meet them where they are and put a really big emphasis, in my opinion, on working with vulnerable populations and making health equity part of what we do. It just needs to be an integral part of everything we do in public health. There's way too much that we see every day that continues to lend itself towards mistrust in government. We may not think as much today, but I think, not to go down a rabbit hole, but just to use January 6th as an example, we've all seen stuff on the news about how an entire group of people made their way into a United States Capitol. What if they had been of a different color? Would they have gotten as far as they did? There's a lot of people who would say no, they would have been stopped way before then. And those populations, see that and they think, oh, because they were mostly white, they got further than they probably would have if they had not been white. And so those kind of things are just continuing to perpetuate. And I think just including health equity in really what we do and listening to those populations, that's how we're going to build trust back. But it's going to continue to take many years.
We've certainly seen those challenges here in Birmingham and across Alabama as well. And COVID here has unmasked many of the inequities that for many people who otherwise wouldn't have seen them or didn't choose to see them. It's impossible not to see the inequities that COVID has revealed regarding particularly racial and ethnic disparities in mortality. Whether it's with COVID or other matters in the commissioner's offices, what are some of the challenges that you deal with at work?
I'd say one of the biggest challenges is funding. We're public health is not a wealthy field. And, I think students who are going into public health don't do it for the money. They're doing it for, and the reason why people are studying public health right now is not a get rich quick kind of rationale. That's not why they enrolled in the School of Public Health at UAB. But funding is something that we consistently struggle with. And sometimes it reverses its course. For example, right now, every time we have a pandemic, or not a pandemic, every time we have a situation, it could be H1N1, it could be SARS, you name it. There's every 2 or 3 years, we have another infectious disease issue that we're dealing with, right? So the federal government will tend to throw a lot of money at it quickly. And, so we go from not having enough money to get the things done that we need to do in public health. Therefore, we have to prioritize, right? Not that one thing's more important than another, but today, something may be more important than something else. So we're constantly trying to strategize that and figure out from a strategic plan standpoint, what makes the most sense for the next 18 months or 24 months. And then we have wrenches thrown in. COVID comes and we get multi-million dollars worth of grants that we have to spend in the next 2 years. And in some instances, spend within 12 months. And that's incredibly difficult to do. So that's a real challenge that we're constantly dealing with. How do we take what we have and make the most of it? And then in other instances, how do we take something that we have a lot of funding for something specific, and there's really not enough time to do anything long-term, infrastructure-wise. It's all short-term and get things done right now because the money will go away. So you can't build an infrastructure and a staff around that because that money is not going to be there. So funding is a big challenge. I think the other big challenge is staffing. Our public health workforce is aging. There's a lot of people, so attrition is going to be a massive issue in the next 10 years. There's a lot of people that will be leaving public health with 20, 30, and 40 plus years of public health experience walking out the door. And so we're going to have that to contend with, and then bringing in new people, right? It's not as easy as one might think to find good staff. So when you find good people, then you need to try and keep them in public health. Some of them want to do that. That's their career. That's what they want. Other people, it's more about the money. And so you may have a struggle hanging on to some of them because they just want to make more. So staffing and funding, I think those are the two big challenges that I'm grappling with pretty much on a daily basis.
And often those two things go together, especially in times of scarce resources, where you don't have the funding to support the staff that you need. Maybe back to your time here at UAB. Think about when you were here as a student. What were some of the experiences or opportunities you participated in while you were at UAB that has made you successful in your career?
I think I mentioned when I first got to UAB that my advisor, called me and just to say hi, basically. I'm your advisor, and here we are. Thanks for being in Birmingham. And so we just got into a discussion about jobs because I had just moved to Birmingham about a week earlier, and I was looking for a job. So as soon as I mentioned stuff about having worked in a lab, he alluded to the fact that he needs someone to help run his lab. And so I jumped on that, and I spent my entire 2 years in Alabama doing that. And that was running the lab. I wasn't working full time doing that. It was a part-time gig, but I was also helping to oversee other students who were working 3, 4, 5, 10 hours a week doing different lab activities, and then doing some of that on my own too. So I spent a lot of time doing that, and then when I graduated, I stuck around for about a year doing some research coordination, continuing some of those reproductive health studies, and then getting into some of the occupational health work because I was an environmental health major, as I said in my undergrad. So this same professor, ironically, did reproductive health and occupational health. So we had a leukemia study we were working on with in the synthetic tire industry. So we were in Louisiana and in different places in Canada, working on those kinds of studies. So most all of my time was spent doing either in class or in those activities, is working various research related coordination, research assistant jobs, but it was all within the same framework under the same advisor. So wasn't really involved in a lot other than that, simply because that kept me pretty busy. There wasn't a lot of time to do other things, but that was okay. The experiences that I was gaining from those positions were experiences that I knew were going to be very beneficial to me as I went forward. So I was soaking it up, doing everything I could to learn from the folks that I was around. And so that's pretty much it. That might sound a bit boring to some folks, but that's pretty much where I spent my time.
Yeah. Well, in thinking about that and thinking about our students now, Jeff, what other suggestions might you give to students who are also doing the same thing, that is working while they're getting their master's in public health?
Yeah. I think some students are working full time doing that, and kudos to them, because that's difficult. If you're working part time and you have the flexibility, I think, to kind of perhaps move around, I would highly encourage students to dabble in different things. Public health is a big field. There's a lot of different stuff going on. Even in a state health department where I am, there's a lot of activities. And whether it's your practicum, whether it's an internship, you're working on your capstone, I would mix it up. Don't put all your eggs in the same basket, because in my opinion, there's nothing better than going out and doing a practicum or an internship in a part of public health that you figure out at the end you don't want to do. Right? That is so valuable. and you might think, well, no, that's not, because I didn't enjoy it. No, that's so valuable, because now there's a certain part of the field that's really not your cup of tea, right? So you want to steer clear of that. So I would highly encourage people to get involved in as many different things as they can throughout their entire graduate studies. I think it's going to make you more well-rounded, first of all, on your resume, and it gives you much better opportunity, I think, to figure out what really makes you tick from a public health standpoint, and what you really don't enjoy very much.
I do know a number of our students in other schools have taken the opportunity to become one of the contact tracers in the contract work that we're doing with the Alabama Department of Public Health. And from the students from whom I've heard, this is an invaluable experience for them, taking what they're learning in the classroom and making it directly applicable to addressing the pandemic right now in real time.
Yeah, I absolutely agree. It's a great opportunity for students to kind of get their feet wet. And I would encourage students as well. There's a lot of contract jobs right now in public health because of where we are with the pandemic. And those positions are contract positions, and they will not become full-time positions because COVID money will go away. So no one in public health is going to be hiring full-time positions with COVID money that's going to end in 12, 24 months. But having said that, I think in the 20 couple years that I've been in public health at the government level, the number of people that we've had to hire contractually has increased over time, because our need is greater than our FTE, our full-time equivalency is. The number of full-time positions we can fill is not as high as the number of people that we need.
Right.
So we'll hire people contractually. And I would encourage students to not shy away from that. A contract position may not come with benefits, et cetera, but it's a really good way to get your foot in the door. Because none of us in public health, and I've yet to meet anyone in public health management who disagreed with what I'm about to say. And that is, if you hire someone contractually and they come in and they just do a bang up job, right? They are a superb employee. I am going to do everything I possibly can to keep that person employed. And so does every other manager that I know. It's in my best interest to keep good people. So you come in contractually, don't shy away from it, take the opportunity, and then prove yourself. It's not always going to work. I'm sure there's going to be times when that just doesn't happen and someone has to let folks go. But by and large, people are going to be working pretty hard to try and keep you around, because as I mentioned earlier, finding really good people is not as easy as one might like to think it would be.
And Jeff, we take that same approach with some of our internships. That is, encouraging students to identify internships at places where they could see themselves working, because that's another way to get your foot in the door and get to be known by that site. Well, let's check back in with Dr. McCormick and see what kind of questions have come up. Dr. McCormick?
Yes, so kind of bouncing off what you were just talking about, Jeff, do you have any advice for students who are maybe just in their first year of a job, so newly employed?
Yeah, so they're out of school and now they're working full time.
Right.
Yeah, I would say, some of those folks just by chance have landed in the right kind of position for themselves, right? But it doesn't happen for all of us. Sometimes we're having a little bit of a struggle to get exactly where we want to be. I think one of the most important things if you land in the right kind of job, then just go in there and work hard and prove yourself, right? Make a name for yourself. If you're not exactly in the role that you want, still do what I said, but networking is so incredibly important. And whether it's in your health department, you can reach out or even if it's a different organization, it might be a nonprofit, etc. If there are other people who are doing things that you really would like to be doing, reach out to those folks. Ask them to ask them to go to lunch with you and when COVID's over. But reach out to folks and get to know them, because they want to have people who want to do what they're doing. So I would absolutely do that. I think networking, I can't stress enough how important networking is. If you're in graduate school and you don't already have a LinkedIn account, you're behind everybody else. So if you just heard that and you don't have one, I hope you're creating one right now. And you can friend me and I'll know that you were listening. It's so incredibly important. And you're gonna meet people. I'll give you a quick example. Someone who was an intern for me 10 years ago, she did not stay in public health. I mean, she did an internship and then she was off, and she was working in the private industry for 10 years. She just reached out to me last week via LinkedIn. That's just ironic, but via LinkedIn, and said, "Hey, Jeff, we're moving back to Richmond," which is a great place to live, by the way. And I was wondering if there's anything you think might be coming up that's open. She was interested in getting in public health. She really liked what she did 10 years ago. And I now have her getting ready to start work as a contractor here at VDH. That's all about networking from 10 years ago. We didn't lose sight from one another. We stayed in touch, and she reached back out and we were able to make something happen. I can't stress that enough.
Another question has to do with wanting to know what are some of the ways that the Virginia Department of Health target health disparities in the communities they serve.
I'll mention the biggest thing, and since a lot of folks who are probably on this call come from the epi world, you can go to the Virginia Department of Health and Google the Health Opportunity Index. That's what I would encourage you to do, HOI. We created it here in Virginia. Our Office of Health Equity actually created it. And it was something that we worked on for many years. When I was in STD and HIV, I helped them craft some of it. We basically started with a vegetable soup of data sources and things, and we kept molding. There's things like Townsend indices in there, like material deprivation and stuff that is all in this vegetable stew. And it got crafted over time. Now there's like 13 elements that make it up, but it's a really nice data source that we can splice many different ways for how we can look at health equity and social disparities throughout the Commonwealth. We use it to help determine where, a hospital might need to be placed. Or there's just a litany of ways that we do that. But that is a big one. And I would highly encourage, anyone who's interested in that kind of thing, go check that out, Health Opportunity Index.
Were you using the Health Opportunity Index to identify areas where you would likely need to do more COVID testing than other areas? Or where now with the vaccine rollout, you may be setting up more vaccination sites compared to other areas?
Yeah, so yes and yes. So, we can pull it down to pretty much any geographic area we want to, and we'll overlay it with all sorts of things. Like where we just started today, testing in CVSs all over, not all over the state, various CVSs around the state started vaccinations today. We are strategically figuring out where we need to do that based on using things like the Health Opportunity Index and overlaying different data sources like pharmacies, right? Where are our pharmacies? Where are pharmacies not located, right? Where do we need to have a pod because we don't have any pharmacies within a 50-mile radius and we need to get help out in this specific area? So we're using it in all of those types of examples.
You've had some type of upper management position for many years, Jeff. In these positions, what skills have you seen that graduates should develop before entering the workplace?
I would say there's a couple of things that I don't think, well, I don't know. When I graduated from public health school, we didn't teach this. Maybe we do now. I did not come out of graduate school with an understanding of how to run a business. And public health is a business. Make no mistake about it. It doesn't matter if you're running, a welfare program, if you're running a WIC program, if you're running an STD program. These programs, these organizations of 10, 15, 50 people or so, they're their own entities in a sense, right? And so I don't think I felt as though I was prepared as maybe I'd like to have been to be in a management role. But part of that is just innate, right? You kind of have leadership qualities or you don't have leadership qualities. But I think, students coming out today, if you have the opportunity to take some electives in things, I think an elective that focuses on how to run an organization, and which would include things like, how do you budget things, right? How do you do budgeting? How do you do strategic planning? How do you do evaluation, right? How do you do these types of things? That's one. The other one that I think in hindsight, if I had to do it over again and I had an elective, I would absolutely take a course in communications. There is no substitute for being a good communicator, understanding how to interact with the media, how to do social marketing. For goodness sakes, we didn't even do social marketing in the late 90s, right? There was no such thing, but we do it all the time now. All these types of things, how do we get the most bang for our buck? Because as I said earlier, since we don't have a lot of money in public health, it's really important for us to do this. Even in, I'll use COVID wise as our exposure notification app in Virginia. We've done marketing all over the state for that. And students might think I had $1.5 million, and that was my budget for doing marketing. And for a statewide marketing campaign, that is not much money. But we've had to make it work, and we've done a pretty good job with it. But still, those are the kind of things you need, kind of the business skills, and you also need to understand how communications work, and how you should really pull that into your position. And if you asked me to order those, I'd probably put communications first, because that's not as intuitive, I think, to a lot of people as business management might be. You're either kind of good at it or not, but then you can hone those skills. Communications really does take some knowledge and some craft to really go in there and do it well.
I couldn't agree more. Back in the mid-90s, I participated in the National Public Health Leadership Institute. And during our week-long in-person session, one of the things that we focused on that was completely new to me was health communications in so-called high-risk, low-trust settings. And Jeff, that training stayed with me more than anything else I did throughout all the time I was in public health practice, and even when I went over into academia. So I couldn't agree more. In my previous setting, we would often get in early career graduates. So someone maybe who had just graduated 2 or 3 years ago and was in a work site. And I would always ask them, if you had to do it over again, what was the one course you wish you had had? I was surprised at the number of young graduates who said, I wish I'd had a complete course in Excel to show me everything, the full power and range of Excel, because it is really a very, very powerful tool. And I know that it's used for simple spreadsheets for most people, but it is a powerful tool.
I completely agree. Excel is not going away. And it is a core function of a lot of what we do. When I started at VDH, there was this thing that not many of us knew much about called SAS. And, it was very popular in the private sector, not in government really. And we jumped in kind of heads first because CDC actually purchased some licenses and were giving them to us. So we had like a handful of licenses. And so I got a lot of our staff to like, we need to get trained up on SAS. We need to figure out what this is. People are asking, I don't know why we need to bother, et cetera, et cetera. And then I even worked with our local university, VCU. They have an MPH program to offer a SAS class so that their MPH students would start to learn SAS. And I know UAB has done that as well. But then even since then, 10 years ago, this thing came out called R. And so we've done the same thing. It's like cyclical, right? So for Epi folks, like, R now becomes kind of the gold standard for me because it's free. And students coming out and having R is excellent. But having a really good foundation in something like Excel and being able to do, pivot tables really quickly, et cetera, that's invaluable.
Well, something that you also just brought to mind, Jeff, when you said the word free, what about EpiInfo? Especially if you're in epidemiology, in public health practice, are y'all using EpiInfo?
It's used a little bit in our general communicable disease programs. They will use it some, but it's largely because the CDC will have systems that they built around it. So there are certain epidemiologists. So if you're in epidemiology, and at least in the state of Virginia, depending on the program area you're part of, that will highly dictate what skill sets you need to bring to the table, right? HIV and STD is big data. So SAS is where we were. General communicable disease was not big data. It was a lot of disease, but not much of any one. So they used things like EpiInfo much more readily, where we did not. So it really depends. I think it's constantly evolving, but EpiInfo is definitely one that's good to at least have kind of a rough understanding of.
What advice do you have to students as they transition to life after school, whether they're in graduate school or undergraduate?
I think probably the best thing I would say, I'm looking over at a quote I have in my office here, right? So it sits on my desk. And I should grab it. Hang on, I'm gonna grab it. Don't go anywhere.
Okay. That's the beauty of these webinars. You can do things like that.
I don't know if you can see it or not. You may not be able to, but it says the best way to predict the future is to create it.
To create it. All right. The best way to predict the future is to create it.
And so I think, you have to kind of know what you want and don't be scared to go get it. Right. There's a fine line, I think, between being humble and being a know-it-all. We don't like know-it-alls, but we do like people who would readily tell you, I'm really smart. Right. I can do that. And they can do that in a humble way. Right. I want to hire smart people. In fact, one of the things that I will repeat anytime people listen to me is, I'm constantly trying to hire people that can replace me.
Right.
That's what I want to do, right? I want people who are smarter than me, who can come in and do my job just as well, if not better than I can. One, that gets me really good people. And two, it keeps me on my toes because they're really smart, right? And that's a great thing. So I think it's just, it really is about believing in yourself and going after what you want to do. And I wouldn't shy away from that. Reach out to the people that you feel like you need to reach out to. Get to know individuals. It's amazing. The power of our social media is amazing. I'll tell you a real quick 30-second story if I have time.
Sure.
I put together a public service announcement for this COVID-wise for our exposure notification app that aired statewide. And I had this idea last spring about what to do and how to do it, but I hadn't done this kind of thing before. And I saw a news clip from an individual who, it was a local news station, and they were doing this story on a guy who was a multi-Emmy Award winning film director. And he was originally from Richmond. He had moved back here a few years ago to deal with like an ailing mother. And I thought, wow, that's the kind of guy I need to talk to, right? To figure out if what I'm doing is even plausible. And so I reached out, I just went out on a ledge and I reached out to him, having no idea if he'd ever get back to me. And guess what? He helped produce this commercial for me that has been airing all over the state for the past several months. And we're really good friends now. And I talk to him weekly, and it's phenomenal. So point being, you never know, right? Reach out to people that you think can help you. Some of them you're not going to hear back from. Some of them you will.
Well, let's check in with Lisa. Lisa, any questions there?
Yeah, really quickly, Jeff. So students who are pursuing their MPH and HCO, which is Healthcare Organization and Policy, get a lot of the business management electives that you're talking about, that you talked about a while ago, and believe that that's the core of their program. But they don't get as many of the hard skills like epidemiology and biostats as students in those disciplines get. What do you think are the job prospects for those type students who are really focusing on those business management skills?
Yeah, no, I think they're actually really good. The problem is you have to figure out how to make that happen. So what I mean by that is we have an entire administrative arm. We're an agency of 4,000 people. So we have a pretty big administrative arm associated with doing all that activity. Most all of those people are not public health people. They're not. They're accountants, right? They're MBA and this, that, and the other, right? They're not public health. So typically, I would think someone that you're talking about is probably going to places like Emory's, public health job site, looking for jobs. Whereas a lot of the jobs that I'm referring to that are these administrative healthcare kind of jobs probably aren't even being advertised there, because the people who run these administrative programs are not public health mindset, right? So I would encourage, I think there's absolutely a place for them, and we need more people like that. So if you have ideas, certainly go to the public health websites and look there, but don't put all your eggs in that basket. I would, if you have a certain area, place you want to go to, if you're thinking about state government, that's your better opportunities. If you're looking to do this kind of thing, there's more opportunity, put it that way. Then go to the state health departments and look at the state websites, right? And look at jobs there, because you may only find them there.
What do you enjoy most about your job?
The people and the purpose, right? There's no group of people like those who work in public health. And I say that wholeheartedly. I mean, I think the dedication of people who work in this field is phenomenal. So I wouldn't change that for the world. And going home either going downstairs or driving home every day, feeling like the things you're doing are making a difference, as opposed to, managing the manufacturing line that makes cardboard boxes, right? Nothing wrong with that. We need to do that, but it doesn't have the same purpose as people who work in public health. So I think those two things are at the top of my list, and I wouldn't change it for anything.
And that's all the more reason why you stayed in public health for as long as you have.
Yeah, that's right.
Well, Jeff Stover, I want to thank you so much on behalf of the School of Public Health, the Office of Public Health Practice, and the Public Health Student Association. I want to thank you sincerely for taking the time to spend some time with us. And we hope that when we're past this COVID, and we will be, that you'll come down for a visit, and we'll take you out to a real lunch.
Yeah, no, I really appreciate the opportunity. I'd love to come back and visit you guys. And, you know, let's do this again sometime. We'd love to.
Right. Right. Thank you so much.
All right. Take care, everybody.